The Spatz3 adjustable balloon system offers an easily adjustable, longer-term balloon therapy that provides a safe, customized balloon weight loss system, now easier and faster for endoscopists. The insertion kit contains the balloon, the extension tube, the provided cap, the insertion facilitator, the syringe, patient card, and chart labels. Using the green tabs, pull the band off to remove all of the bands. Turn the three-way stopcock as shown, and then connect the extension tube to the valve. Push the valve hold into the white catheter as shown. Confirm that it is in place. The device is ready for implantation. Prior to implantation, a standard endoscopy is performed to evaluate for contraindications. After completing the endoscopy, dry the endoscope thoroughly. With 2 fingers, hold the insertion facilitator and place it on the end of the scope. While the assistant holds the scope, grasp both sides of the insertion facilitator and pull until the distal edge is at the scope tip. Do not unroll it yet. Now, roll it back until it covers the proximal hole. Find the left side of the scope using the up-down dial as shown. Place the distal tip of the balloon just touching the insertion facilitator and roll it over the balloon. The balloon tip should be within millimeters of the proximal hole. Pull the proximal hole over the scope, and then the distal hole over the scope. Pull it all back to the balloon tip. Hold the endoscope and device in one hand and generously lubricate the balloon, endoscope, and valve areas, as well as inside the mouthguard. Insert the endoscope and device as you would in a normal endoscopy. A snug fit at the mouthguard and the upper sphincter are to be expected. Pass to the antrum. Retroflex to confirm presence of the balloon in the stomach. If the balloon fell off in the esophagus, you will need to push it down below the GE junction. Attach the 3-way stopcock to the saline bag and the syringe. Inflate the balloon. We recommend 450 to 550 cc's. If resistance to inflation is encountered, advancing the endoscope 5 to 10 centimeters will generally undo any kink in the line. Once inflation has concluded, withdraw the endoscope to the distal esophagus. As you pull back, you will see the balloon and you will feel pressure as the balloon releases from the insertion facilitator. While the endoscope remains in the esophagus, pull the extension tube until the valve exits the mouth. Secure the valve. Disconnect the extension tube. The valve is wet and slippery. Dry the valve and your gloves, or change your glove as shown. Tighten the cap in its place. A loose cap will cause a leak. Lower the valve into the back of the throat. It will pull itself back to its position. Push the scope forward and backward, gently, to help the valve move through the upper sphincter. Gently push the cap and catheter below the GE junction. Make sure the white catheter balloon junction faces proximally. If necessary, flip the balloon. Gently pull the scope out. You will feel the rolled up insertion facilitator move through the upper esophageal sphincter. Pull slowly and gently. The procedure is now complete.